is such a pleasure to have you here with the American Acne and Rosacea Society today. Dr. Lee, thank you for joining us.
Thank you for having me here.
We appreciate
really
it.
nice.
We are so excited about Acne Awareness Month and getting a chance to talk with you and a lot of our members. So excited to join you for a couple of questions that we have for some of our members.
Hopefully I can answer them. We'll see.
Well, you know, I'm sure you can. So we've been fascinated watching Dr. Pimple Popper and all the things that you do. And obviously it's a little bit of a lighter take on acne sometimes, but it also...
Or a heavier take too sometimes.
For sure.
Yes. It's much more than just pimples.
It for sure is. Very serious skin conditions, including acne as well. And why is it that, from your perspective and all the things that you've seen, that we should take acne seriously?
Well, I like to say that, I like to reassure people, and they know this, people in general know that, acne does not directly threaten our life, but really so many people, 50 million people in America alone suffer from acne, or 85 to 95% of the population has had a pimple or acne at some time in their life. And so I think it's something that, like I said, doesn't threaten our life, but can certainly threaten our well-being, our emotional well-being. And, it hurts. It's uncomfortable physically, too. But I think especially the fact that it occurs usually in its more severe form during puberty, or when you're in that age where you're just trying to figure out your place in the world, and you're feeling more timid than probably other times in your life, and you're just not so sure about yourself, and it really can potentially, change a person's personality or how they develop. And
for sure.
So I think that's why it's very important for people to know that there are great treatment options, and just to understand that acne's there and that it's not your fault.
Definitely. I think that's one of the things that we've seen as well, as we do talk about, for many of the acne patients, they are going through pain in many cases. Have you seen that as well with people that you've met?
I mean, I've seen quite aggressive cases, like all of us dermatologists do, acne conglobata or acne fulminans, where it's quite aggressive, and sometimes you'll start medications and they might get a little worse before they get better, and it's scary. It's scary for the parents. It's scary for a child, like a young teenager, to have this, and for it to be so uncomfortable, and for it to feel like your body is out of control.
Sure. I think it's also important to set those realistic expectations for patients and their caregivers too. Do you have any advice around that in terms of giving some guidance to patients?
Right. Usually we'll tell people, to not expect acne didn't start overnight, so it doesn't really get better overnight either. So you do have to be patient, and sometimes we want to find the perfect regimen for people, a perfect treatment option. And so sometimes it's a little trial and error. But I think seeing a dermatologist would be your first step, really, if you are concerned about, your acne and you want treatment, and you want to find a treatment that works probably quicker, is because we kind of understand, the treatment options, what is out there, and what might work best for your type of acne.
Sure. That absolutely mimics what we say to patients as well, is that we really want them to seek their board certified dermatologist or healthcare professional, and then ultimately as well to really fight for that individualized treatment regimen. What works for one may not work for the other one. I think that's where some of the frustration comes for patients. Have you seen that?
And it doesn't happen overnight. Yes.
Yes.
Yeah, I mean, that is very true. And that I say that all the time for many things, for many skincare regimens. What your best friend does or what your idol may do on social media is not necessarily what's for you, because you have different skin types, you have different issues. So remember that. I think the best thing, and what is a good thing about social media, is I feel like it's taught people how to identify their sort of skin type, what kind of skin you have, so that and then people are interested in knowing about what products do, and so they can maybe be paired up with the right treatment option.